Hello and thank you for joining me. Still on the matter, dieting and exercise is not enough to prevent the development of health problems. We started talking about this and we looked at the risk factors. Specifically, we looked at the non-modifiable risk factors in the last couple of videos. We talked about gender and we talked about ethnicity. Today, we're going to be talking about the last in that category, which is what? Genetics and family history. I had a patient that came in 2 times with a high blood pressure, over 200 systolic blood pressure, over 150. And there was nothing we gave him that worked. So I told him, you know what? You've come in 2 times. Why don't you ask your family members if anybody has hypertension running in the family? And he said nobody did. So I said, I'll see you in 2 days. That was a Friday. I saw him on the Sunday and I asked him and he looked very sad. And I said, what's going on? And he said, would you believe that all my cousins from my father's side of the family all have had hypertension for the past 20 to 30 years? I said, really? He said, that's not even the most sad of the news. The saddest part of it is that my mother suffered with hypertension all through my growing up. And she never told me, and I said, you didn't need that information at the time. Now you do need the information. Now, why is this important? The medications that his family members have used that have worked for them is the same one that will now be tailored to his use. Because there is a family history of this particular disease, it's very common that what has worked for other members of the family will work for him. I hope this helps.